So my journey started about 8-9 years ago. At my heaviest weight, I was about 340 pounds. I had been eating poorly for the better part of a couple of years, gained a lot of weight, was having a lot of trouble getting it off. I decided to finally take control of my weight and my health when my father had a heart attack. I consulted with a bariatric doctor. I ended up getting on a nutritional plan, having bariatric surgery, and losing over 140 pounds. What I found after that was I felt a lot better, my health was great, but I still visually had a lot of problems with the way I looked. From years of extra weight being in my body, I had a lot of extra loose skin that I just couldn't get rid of no matter what I did. What really inspired me to get this done was I spoke with some friends of mine who had had cosmetic surgery, and they told me about the great experience that they had. They told me that it was an investment in their body and that they were really happy with the result. And after my family and I talked about it, I decided I was going to invest in my body and myself to take this final step for weight loss, my weight loss journey, and get to that final product where I wanted to be. I chose Austin-Weston because it had a great track record. I did extensive research through the internet, asking around, finding former patients, asking a friend who I knew had surgery here, and I heard nothing but good things about Austin-Weston. It's one of the most highly regarded plastic surgery centers in the area, and they've been in business for over 35 years, so I knew that they had the experience to handle my type of case. That I was still not going to be happy with the result, that my case was going to be too difficult and that I wouldn't be able to be fixed. I had gotten so accustomed to having this loose extra skin that I was stuffing into my jeans every morning that I had a hard time visualizing that it was going to go away. Well, the first and most important thing about my consult with Dr. Poindexter was that the first thing he did was he listened. He listened to me, he listened to what my concerns were and what I wanted to accomplish. And then he was able to take what he knew as an experienced physician and explain to me what he recommended we do. So he walked me through every step of the process, what his plan was going to be, and we went from there. And it truly was inspiring after we finished our consult that this was going to get done. I think the biggest thing that faces men is that we aren't supposed to look good. That cosmetic surgery and having things fixed or repaired on your appearance is not for us, and that we're just okay just the way we look. That stigma needs to go away. It's okay for us to want to look better and fix something that needs to get fixed, and that's where cosmetic surgery comes into play. Not only has my confidence gone up extraordinarily, my just general mental health has improved. I feel better about the way I look. I feel better about shopping for clothes, and I'm really looking forward to jumping in the pool this summer without a shirt on for the first time in a really, really long time. First thing I would say is ask around, talk to people, try to find someone that's had the surgery. Look at 4 reviews online, and honestly, just call up and make a consult. There's no obligation. You don't have to do anything. There's no pressure. They're gonna walk in. You're gonna ask questions. They're gonna give you answers, and if it's right for you, you're gonna proceed forward. There's no harm in coming in and just asking. So the money aspect, of course, is a very important part for this type of surgery and this investment. My family and I talked about it, and we decided that if this was an important investment in my body and in my life. And so we were able to save for a little bit, and then we were able to decide that we were going to take out a small loan that was very manageable to take care of the rest of it. And like I said, people have no problem in taking out a loan or borrowing money to fix their kitchen or make an improvement somewhere else. Why not do the same to invest in the way you look and how you feel about your body for the rest of your life. Best part of my experience was the amount of support that I got from the staff from day one. From the time I had my consult, I was in constant communication with the consultancy staff, and any questions I had, I got an email back, phone call back, within minutes, if at most hours. A lot of times you find that you call a doctor's office, you don't get a call back for days, and the responsiveness was great. And then post-surgery, I felt that any concern that I had was immediately addressed during my follow-up surgeries. Every concern, every question was answered throughout without really any hesitation. And that support system, pre and post-surgery, is huge. I was very surprised about how quickly I recovered. I know that recovery is dependent on a lot of things and can vary between patients, but between the methods that they used, that the fact that the surgical team employed local anesthetics and utilized non-narcotic painkillers to help reduce the amount of narcotics needed, I felt better, faster, with way less side effects. I told my doctor that, yeah, I didn't feel well the first few days, and I spent the majority of it in bed, but by day 5, I was up and I went on a 2-mile walk. I felt that good.